Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. We are pleased to welcome Board Certified Nurse Practitioner Stephanie Nerette and Dr. Jean-Claude Nerette Jr., a married duo focused on the optimization of health through hormonal balance based in Weston, Florida. Thank you so much for being with us today.
Thank you so much for having us.
Thank you.
Of course, I have to ask, how did you two meet?
Stephanie.
Well, we met in the ER. I was working as a paramedic firefighter at the time. And I was in school for my nurse practitioner, and I did my last rotation in the emergency room at Cedars Hospital, which is now University of Miami. And when I was on shift, one of the nurses came to me and said, the doctor would like you to go over there and introduce yourself to him. I was like, oh, brother. So I went over there and I talked to Dr. Nerette. I introduced myself. And I remember walking away like, man, this guy's something else. Needless to say, there wasn't a date shortly thereafter. It took us a couple months after that. It was actually my graduation from nurse practitioner school that we invited the whole ER staff, and he happened to be there. And he wasn't leaving the party without a date on the schedule. And that's how we met.
Nothing to add. I was really minding my own business in the emergency room, and you have a blonde firefighter walking in your ER. What could you do?
Can I ask, what led you to decide to open a practice together?
You know, before Stephanie, I actually had opened a small cosmetic practice. It was called Silk Touch in South Beach. Things didn't go well. I had the wrong partner. And then I met Stephanie, and she saw the right partner. And then we saw the potential, and we just went for it.
Can you tell us about some of the services you offer in your practice? And are there any particular services you wish more clinicians knew about?
Yeah. At the beginning, we started doing cosmetics only. And it was very interesting of how the practice grew, because we heard more and more from our patients, most of them being women, of really how badly they were being treated by the primary care doctor when they had a problem, especially when they went into menopause. I mean, we were here, patients say that their doctor told them get bigger fans to treat the hot flashes, or they were on antidepressants where they were not depressed because they were in menopause, or birth control pills. So slowly but surely, our practice went from 90% cosmetic to 10% medicine to now 90% functional personalized medicine and only 10% cosmetic.
It was interesting. When we first started, we actually started a mobile business. It was a hobby. We both loved the aesthetics. So what we did was we rented a mobile van, and we went to different sites that we had a room that we rented. And within minutes, it looked like we were there forever. And we would have our own aesthetic patients that we would see. And like how Dr. Nerette said, the patients kept on saying, hey, listen, I really wish you would take care of this, or I wish you would take care of this, because we would sit down with the patient, we would set aside time and actually talk to them and do more of an individualized approach. And the patients just loved it. And the mobile practice was so successful that actually it ended up being more than just a hobby, where at one point, Dr. Nerette was working in the ER, and myself, I was working City of Miami as a firefighter. And we decided, you know what, it's time to go ahead and evolve and grow the practice even further, and to actually do this full time. So that's kind of a little bit about how we evolved to that.
And the question you had about my clinicians, I really wish, and we're trying to make it better known, of what is functional medicine, what is personalized medicine. because I see that our colleagues, they're not aware of what we really do. They're a little stumped that their patients are coming to me, and in a matter of months, we fix their problem. And while it took them a matter of years and still they did not fix the problem. So we're trying to be out there more in the community to let people know this is, evidence-based medicine. This is medicine done the right way, using more of a natural approach and looking for the root cause of the problem. So I wish more of my colleagues would know of what we do to be able to work together, not against each other, for the patient.
I agree. I think the biggest thing is to have collaboration with other physicians in the community would be fantastic. And I think as we start becoming more well-known as far as with functional medicine, it is starting to happen. So we encourage that, and hopefully it continues.
You have both been practicing integrative medicine for quite some time. How have you seen the field in your particular approaches evolve? And are there any particular changes you have found most striking?
I think as far as evolving, we kind of alluded to it before. When we started the practice, we were just kind of doing aesthetic medicine. And it's evolved now where we're taking on harder and harder cases, so to speak, more involved cases. Before it was just hormone balance. Now we're doing more autoimmune than we had ever imagined. And, really it's thanks to A4M and thanks to your teaching that you really helped us and guide us along as far as with protocols. I mean, Dr. Pamela Smith has been just instrumental in our learning process, and we really appreciate that. So it's really seeing the need from our patients and then just growing. Our practice is mainly adults for the most part. We don't advertise that we take care of children, but it's really evolving where we're taking care of more pediatric clientele and adolescents because of the need, because they're not being adequately treated. So it's really our clients who are bringing in their children, like, you got to help me out here. We've seen multiple doctors and we're not getting the answers. So we're very privileged to have that with our clients.
Many clinicians have different viewpoints and philosophy on the relationship between aesthetic and purely medical care. How do you view this relationship between aesthetics and medical care?
Well, I think it's important to first, and I talk to my patients about this every day, first fix the inside. For example, the gut. The gut is linked to the skin. How can you have a healthy, flexible, shiny skin if you have leaky gut syndrome, if you have, other conditions? And I think our patients trust us. So once we fix their inside, they're much more comfortable to stay here for cosmetic treatment rather than going down the street. So it's kind of like a all-in-one place.
Absolutely. We're treating both inside, and we want them to look and feel as good as they do inside on the outside.
What challenges and barriers have you faced with this style of practice? And how have you dealt with them clinically, financially, professionally, or socially?
I mean, probably the biggest barrier, I think patients now are so smart because of the internet. They know how to look at medical studies, and they know how to look at my background to see, hey, should I trust this person? And that, to me, that's one of the most important things, and we discussed it during the first interview. I think the biggest really obstacle, to be honest, are my colleagues. And it's mainly because of the ignorance of what we do, the ignorance of what is bioidentical hormones. They still think estrogen is estrogen, doesn't matter where it comes from, even though we have so many good studies since 1935 throughout the whole world. So it's just education of our colleagues to be able to work together. For the ultimate goal is to treat our patients with the optimal effects.
I agree with everything he said.
And final question. Your practice has no doubt evolved and grown since you first began. Where would you like to see your practice in the next 5 years?
We're actually working on that now. I mean, my goal, and the reason I think I was placed on earth, is to tell more people of that they have an alternative. There is another option if they're going to a particular practice and they're not getting better, they're still getting sick. I mentioned the laboratory work as the report card. If they're going to the primary care doctors, they're still feeling ill, and the report card, they still get a C- or a D, there is an alternative out there, functional medicine, and just to let more doctors know of what we do. My job as the doctor of the practice is to look for new treatments, advanced treatments, new testing. We are so fortunate in this country to have so many laboratories that cater to us, genetic testings. Specialized testing is, I think, how we differentiate ourselves from traditional medicine, always looking for the root cause. And in functional medicine, we have so many specialized testing that even my colleagues don't even realize that we offer. For example, most of the cancer and illnesses are linked to toxins. Who's not toxic in this country? So we have specialized testing looking at environmental toxins, mold. I've seen so many people in Florida with mold toxicity that have been sick for decades and not be able to get better because no one has even thought of mold testing and heavy metal testing. So we're fortunate to have those specialized testing to be able to advance and improve our patients' health. Another example, if I may, is patients with gut issues. If they go to the gastroenterologist, they might walk out with an endoscopy, but they don't understand endoscopy has nothing to do with the function. Endoscopy has to do with the structure. Are you bleeding? Do you have a mass? So most people, our office is located across one of the local hospitals. They go from the hospital and they come to me, and we do a very specialized stool testing that allows to see the function of the gut, the inflammation, the immunity of the gut, and it kind of gives us a map of how to better treat our patients. And that's why most of our patients, regardless how long they've been ill, I could fix them or get them significant improve within 3 to 6 month period.
Thank you so much, Stephanie and Dr. Nerette, for sharing your time with us today. We appreciate you.
Thank you so much for having us.
Thank you, Lindsay. Thank you for everything.